Hello, everyone, and welcome back to Learning English Studio, where learning English is easy and fun. I'm Amelia.
Hello, Amelia. Hello, everyone. It's great to be here.
Hi, James. How are you today?
I'm doing great, thank you. And you? You look very happy today.
I am very happy today. I'm excited for our topic today.
Oh, yes, it's a very good topic. Very important.
Yes, exactly. But before we start, everyone please remember to subscribe to our channel. Yes, and click the like button, and please share our podcast with your friends and family. It helps us a lot. It really does. Okay, so James, are you ready?
Absolutely, Amelia. I'm ready to talk about health in English. It's such a useful topic for everyone, especially for our listeners who are learning English and want to talk about their daily lives.
Perfect. So today, we're going to explore how to talk about your health in simple, everyday English. We'll learn common words and phrases, discuss how to describe how you're feeling, and share some tips on staying healthy. It's going to be super practical for beginners who want to have basic conversations about health. So, James, let's start with the most basic question. How are you? We hear this all the time, but what are some common ways to answer?
That's a great starting point, Amelia. The simplest answer is, I'm fine or I'm good, but there's so many other options. If you're feeling really good, you might say, I'm great, I'm excellent, or I'm wonderful. If you're doing okay but not amazing, you could say, I'm all right, I'm not bad, or I'm okay. And if you're not feeling well, you might say, I'm not feeling so good, I'm a bit under the weather, or I'm feeling sick.
I'm a bit under the weather. I love that expression. It's such a gentle way to say you're not feeling well. What about when someone asks, how's your health? Is that different from how are you?
Oh, that's a good question. How are you is a general greeting, and people often expect a short, positive answer, even if they're not feeling great. But how's your health is more specific. People usually ask this when they genuinely want to know about your physical condition. You might answer, my health is good. I've been feeling quite healthy lately, or I've had some health issues recently. It's a more open invitation to talk about your actual health status.
That makes sense. So, how are you is more of a social greeting, while how's your health is a more specific question about your physical well-being. Let's talk about some common health problems people might experience. What are some simple ways to describe common illnesses?
Well, there are many common health problems that people experience. For a cold, you might say, I have a cold, I've caught a cold, or I'm getting a cold. If you have a headache, you'd say, I have a headache, or my head hurts. For a stomachache, it's I have a stomachache, or my stomach hurts. If you have a fever, you'd say I have a fever, or I'm running a temperature. And for general tiredness, you might say I feel tired, or I'm exhausted.
Those are really useful phrases. I think many of our listeners will use these a lot, especially during cold and flu season. What about describing pain? How can people talk about where they hurt and how much it hurts?
That's such an important skill. To describe where it hurts, you can simply say, my body part hurts. For example, my back hurts, my throat hurts, or my knee hurts. To describe how much it hurts, you could use words like a little, quite a bit, or a lot. So you might say, my head hurts a little, or my stomach hurts quite a bit. Another common way to describe pain is using adjectives like sharp, dull, throbbing, or burning. For example, I have a sharp pain in my chest, or I have a dull ache in my lower back.
That's really helpful. Being able to describe pain specifically is so important, especially if you need to see a doctor. What about some common symptoms of illnesses? How can people describe what they're experiencing?
There are many common symptoms you might want to describe. If you have a cold, you might say, I have a runny nose, I'm sneezing a lot, or my nose is stuffy. If you have the flu, you might say, I have chills, my body aches, or I feel weak. For a stomach problem, you might say, I feel nauseous, I have diarrhea, or I've been vomiting. And for allergies, you could say, my eyes are itchy, I can't stop sneezing, or I have a rash.
Those are really useful phrases. It's so important to be able to describe your symptoms clearly. Let's talk about going to the doctor. What are some common phrases people might use when they visit a doctor?
When you visit a doctor, you might start by saying, I'd like to make an appointment, or I need to see a doctor. When you're with the doctor, you could say, I haven't been feeling well lately, or I've been experiencing some symptoms. The doctor might ask, what seems to be the problem, or how long have you been feeling this way? You could answer, I've had this headache for 3 days, or I started feeling sick yesterday. It's also helpful to know phrases like, I'm allergic to something, or I'm taking medication for condition.
Those are really practical phrases for medical situations. What about at the pharmacy? How can people talk to a pharmacist about medicine?
At the pharmacy, you might say, I'd like to buy some medicine for a cold, or do you have something for a headache? The pharmacist might ask, are you taking any other medications? Or do you have any allergies? You could respond, no, I'm not taking any other medications, or yes, I'm allergic to penicillin. It's also good to know how to ask about dosage. How often should I take this, or should I take this with food? And the pharmacist might say, take 1 tablet every 4 hours, or you should take this after meals.
That's really helpful information. Communication with healthcare providers is so important. Let's switch gears a bit and talk about staying healthy. What are some common phrases people use when talking about healthy habits?
When talking about healthy habits, people often mention things like, I try to eat a balanced diet, I avoid junk food, or I eat plenty of fruits and vegetables. For exercise, you might hear, I go to the gym 3 times a week, I enjoy jogging in the morning, or I try to walk every day. For sleep, people might say, I try to get 8 hours of sleep, or I have a regular sleep schedule. And for stress management, you could say, I practice mindfulness to reduce stress, or I like to read to relax.
Those are great examples of healthy habits. It's interesting how many different aspects of health there are: diet, exercise, sleep, stress management. What about some unhealthy habits? How might people talk about those?
People might talk about unhealthy habits like, I eat too much junk food, I don't exercise enough, or I stay up too late. Some people might say, I smoke a pack of cigarettes a day, or I drink too much coffee. Others might mention, I spend too much time sitting, or I'm addicted to my phone. When people want to change these habits, they might say, I'm trying to quit smoking, or I'm cutting back on sugar. It's important to be able to talk about both healthy and unhealthy habits without judgment.
That's such a good point about not being judgmental. Everyone has areas they could improve in when it comes to health. Let's talk about mental health. How can people talk about their emotional well-being in English?
Mental health is such an important aspect of overall health. People might say, I've been feeling stressed lately, or I'm dealing with some anxiety. For depression, someone might say, I've been feeling down, or I've lost interest in things I used to enjoy. For positive mental health, you might hear, I've been feeling really positive lately, or I'm in a good place mentally. It's also common to talk about strategies like, I see a therapist, or I practice mindfulness to manage stress. The key is to be able to express your feelings honestly and seek help when you need it.
That's so important. Mental health is just as important as physical health, and being able to talk about it is crucial. What about some common health advice people might give or receive? What are some typical phrases?
Common health advice often includes phrases like, you should get more rest, make sure to drink plenty of water, or you need to eat more vegetables. For exercise, you might hear, you should exercise regularly, or try to reduce stress. For specific problems, you might hear, you should see a doctor if it gets worse, or have you tried taking vitamin C? It's also common to hear more general advice like, listen to your body, or health is wealth. These phrases reflect the wisdom that taking care of your health is one of the most important things you can do.
Health is wealth. I love that proverb. It's so true. Let's talk about some common health checkups. What kind of vocabulary do people need when talking about routine medical examinations?
For routine checkups, you might hear phrases like, I have an annual checkup, or it's time for my physical examination. Common tests include blood test, blood pressure check, cholesterol test, or blood sugar test. People might say, I need to get my eyes checked, or I'm due for a dental cleaning. Women might talk about getting a mammogram or visiting the gynecologist, while men might mention getting a prostate exam. It's also common to hear about vaccinations. I need to get a flu shot, or I'm up to date on my vaccinations.
That's really useful vocabulary for healthcare. Prevention is so important when it comes to health. What about some common health emergencies? What phrases might people need in urgent situations?
In health emergencies, it's important to be clear and direct. You might say, I need to go to the emergency room, or please call an ambulance. For specific emergencies, you could say, I'm having trouble breathing, or I think I'm having a heart attack. For injuries, you might say, I've broken my arm, or I cut myself badly. It's also helpful to know phrases like, where is the nearest hospital, or is there a doctor here? In emergency situations, simple, clear communication is crucial.
That's really important information for emergencies. I hope our listeners never need to use those phrases, but it's good to know them. Let's talk about some alternative or complementary health practices. How can people discuss things like acupuncture, herbal medicine, or meditation?
Alternative and complementary health practices are becoming more mainstream, so it's useful to know how to talk about them. For acupuncture, someone might say, I'm trying acupuncture for my back pain, or I have an acupuncture appointment today. For herbal medicine, you could hear, I take herbal supplements to boost my immune system, or I prefer natural remedies to conventional medicine. For meditation, people might say, I meditate for 10 minutes every day, or meditation helps me manage stress. Other practices include yoga, like I do yoga to improve flexibility, chiropractic, like I see a chiropractor for my neck pain, or massage, like I get a massage once a month to relax. It's good to be able to discuss these options, especially if they're part of your health routine.
That's really interesting. There are so many different approaches to health and wellness. Let's talk about health insurance. What vocabulary do people need when discussing healthcare coverage?
Health insurance can be complicated, but there are some basic phrases that are helpful. You might hear, do you have health insurance? Or what does your insurance cover? People might say, I need to check if my insurance covers this treatment, or I have a high deductible plan. Common terms include premium, the amount you pay for insurance, copay, the amount you pay for a service, deductible, the amount you pay before insurance starts covering, and out-of-pocket maximum, the most you'll have to pay in a year. People might also talk about in-network, providers that work with your insurance, versus out-of-network, providers that don't. Understanding these terms can help you navigate the healthcare system more effectively.
That's really helpful information. Health insurance can be so confusing, but it's so important. Let's talk about some common health myths. What are some misconceptions about health that people might talk about?
There are so many health myths out there. One common myth is that you should starve a fever and feed a cold. In reality, you need nutrition when you're sick with either. Another myth is that cracking your knuckles causes arthritis. Studies have shown this isn't true. Some people believe you need to drink 8 glasses of water a day. While hydration is important, the exact amount varies by person. There's also the myth that you can sweat out toxins. Your liver and kidneys do that job, not your sweat glands. And many people believe carbs make you fat. It's actually about total calories, not specific food groups. It's interesting to discuss these myths and the science behind them.
Those are such common myths. It's amazing how many misconceptions there are about health. Let's talk about health and aging. How can people discuss health changes as they get older?
As people age, they might notice various health changes. They might say, my eyesight isn't as good as it used to be, or I have more aches and pains now. Common age-related health discussions include, I need reading glasses now, or my hearing isn't what it used to be. People might talk about, I have to watch my blood pressure, or I'm taking medication for cholesterol. There might also be positive changes, like I'm more conscious about my health now, or I've learned to listen to my body. It's important to approach these changes with acceptance and proactive care, focusing on maintaining health and quality of life at every age.
That's such a healthy perspective on aging. It's all about adaptation and proactive care. Let's talk about health and travel. What phrases might people need when discussing health while traveling?
Health travel is an important topic. Before traveling, people might say, I need to get travel vaccinations, or I should buy travel insurance. During travel, you might hear, I have traveler's diarrhea, or I think I'm having food poisoning. People might ask, is the tap water safe to drink here? Or do I need malaria medication for this region? If you get sick abroad, you might need to say, I need to find a doctor, or does my insurance cover international medical care? It's also common to discuss jet lag in remedies, like I try to adjust to the local time zone right away, or I take melatonin to help with jet lag. Being prepared and knowing these phrases can help you stay healthy while traveling.
That's really useful information for travelers. Health considerations are so important when visiting different places. Let's talk about some common health apps or technology. How can people discuss using technology for health management?
Health technology has become so popular. People might talk about, I use a fitness tracker to count my steps, or I have an app that tracks my sleep. There are apps for meditation, like I use a meditation app to reduce stress, or nutrition, like I track my calories with this app, or exercise, like I follow workout videos on YouTube. People might discuss, my smartwatch monitors my heart rate, or I use a blood pressure monitor at home. There are also more specialized apps, like I track my blood sugar with this app, or I use a period tracker app. It's interesting how technology has made health management more accessible and personalized for many people.
That's so true. Technology has really changed how we approach health and fitness. Let's talk about health and work. How can people discuss health issues related to their jobs?
Work-related health issues are common. People might complain about, I have back pain from sitting all day, or my eyes are strained from looking at the computer. Office workers might talk about, I have repetitive strain injury from typing, or I get tension headaches from stress. Physical laborers might say, my back hurts from lifting heavy objects, or I have sore muscles from my job. People also discuss work-related stress, like my job is very stressful, or I'm burned out from work. Solutions might include, I'm trying to improve my posture at my desk, or I take regular breaks to stretch. Some companies offer ergonomic assessments or wellness programs to address these issues. It's important to recognize how work affects health and take steps to minimize negative impacts.
That's so important. Work takes up so much of our lives, and its impact on health is significant. Let's talk about health and environment. How can people discuss how their surroundings affect their health?
Environmental factors can definitely impact health. People might talk about, the air quality is poor today, or I have allergies from the pollen. Those in cities might say, the noise pollution affects my sleep, or I'm concerned about pollution. Others might discuss, I get headaches from fluorescent lights, or my skin is dry from the air conditioning. There are also positive environmental factors, like I love living near the ocean, it's so calming, or having plants in my home improves my mood. People might also talk about, I try to use natural cleaning products to reduce chemical exposure, or I avoid plastic containers for food storage. Being aware of how our environment affects our health can help us make better choices about where we spend our time and what we expose ourselves to.
That's so interesting. Our environment really does have a big impact on our health in both positive and negative ways. Let's talk about health and relationships. How can our social connections affect our well-being?
Social connections are so important for health. People might say, my friends support me in staying healthy, or my partner encourages me to exercise. Positive relationships might be described as my family helps me manage stress, or talking to my friends improves my mood. On the other hand, people might discuss negative impacts, like my stressful relationship affects my health, or I don't have time for self-care because of my family responsibilities. Some might talk about I exercise with friends to stay motivated, or my partner and I cook healthy meals together. There's also the concept of social health, having a strong support system and meaningful connections. It's fascinating how our relationships can have such a profound effect on our physical and mental well-being.
That's so true. We're social creatures, and our connections with others really do affect our health in so many ways. Let's talk about health and food allergies or intolerances. How can people discuss these dietary restrictions?
Food allergies and intolerances are common topics of conversation. People might say, I'm allergic to peanuts, or I'm lactose intolerant. When eating out, they might ask, does this dish contain nuts, or do you have gluten-free options? At social gatherings, people might explain, I can't eat dairy, or I need to avoid shellfish. Some might discuss, I have celiac disease, or I'm on a low FODMAP diet for IBS. Others might talk about, my child has multiple food allergies, or I carry an EpiPen for severe allergies. It's important to be able to communicate these restrictions clearly to ensure safety and also to understand others' dietary needs when hosting or sharing meals.
That's really important information. Food allergies and intolerances can be serious, and clear communication is crucial. Let's talk about health and seasons. How can people discuss seasonal health changes?
Seasonal health changes are very common.
That's so true. The human-animal bond is really special and can have such positive effects on health. Let's talk about health and finances. How can money affect our well-being, and how do people discuss this connection?
The connection between health and finances is significant. People might say, I can't afford healthy organic food, or gym memberships are too expensive for my budget. Others might discuss, medical bills are causing me stress, or I don't have health insurance because it's too costly. Some might talk about, I prioritize my health and my budget, or I've set up a health savings account. There are also conversations like, I'd rather spend money on experiences than things, or investing in my health now will save money later. Financial stress can definitely impact physical health, leading to issues like high blood pressure or sleep problems. On the other hand, good health can reduce medical expenses and improve financial stability. It's a complex relationship that many people navigate daily.
That's so true. The health-finances connection is really significant and affects so many people. Let's talk about health and education. How does what we know affect our well-being?
Health education is so important. People might say, I learned about nutrition in school, or I read health articles to stay informed. Others might discuss, I didn't learn about mental health growing up, or I wish I knew more about first aid. Some might talk about, I took a CPR class, or I'm learning about herbal medicine. There are also conversations like, I teach my children about healthy eating, or health literacy is important for everyone. The more we know about health, the better decisions we can make for ourselves and our families. This includes understanding our bodies, recognizing symptoms, knowing when to seek help, and making lifestyle choices that promote well-being. Health education empowers people to take control of their health in informed ways.
That's so true. Knowledge really is power when it comes to health. Let's talk about health and culture. How do different cultural backgrounds affect health practices and beliefs?
Cultural influences on health are fascinating. People might say, in my culture, we use herbal remedies, or my family believes in traditional medicine. Others might discuss, my culture has specific dietary practices, or we have traditional healing ceremonies. Some might talk about, I combine Western medicine with traditional practices, or my cultural background affects how I view mental health. There are also conversations like, I'm learning about health practices from other cultures, or I've adapted traditional recipes to be healthier. Cultural beliefs can influence everything from diet and exercise to healthcare decisions and end-of-life choices.
It's understanding these cultural differences is important for healthcare providers and for anyone navigating our diverse world. It's also interesting to see how different cultures approach health and wellness and what we can learn from each other.
That's so interesting. Cultural perspectives on health really do vary widely, and there's so much we can learn from different traditions. Let's talk about health and the future. What emerging trends or technologies might change how we approach health?
The future of health is exciting. People might discuss, I'm interested in personalized medicine based on my DNA, or I'm tracking my health with wearable technology. Others might talk about virtual doctor visits are so convenient, or AI is helping diagnose diseases earlier. Some might say, I'm curious about gene editing for disease prevention, or nanotechnology could revolutionize drug delivery. There are also conversations about, I hope healthcare becomes more accessible and affordable, or I'm concerned about privacy with health apps. Emerging trends include precision medicine, telemedicine, AI in healthcare, and wearable health tech. These developments promise to make healthcare more personalized, accessible, and effective. It's an exciting time for health innovation, though it also raises important ethical and practical questions that we'll need to address as a society.
That's so fascinating. The future of health really does look exciting, with so many possibilities on the horizon. Well, James, we've covered so much today about talking about health in English, from basic greetings to specific symptoms, from healthy habits to healthcare systems, from cultural perspectives to future trends. Is there anything else you'd like to share with our listeners before we wrap up?
Just that health is a universal human experience, and being able to talk about it in English opens up so many opportunities for connection and care. Remember that it's okay to not feel well sometimes, and it's important to be honest about how you're feeling. Don't be afraid to ask for help when you need it, whether that's from a friend, family member, or healthcare provider. And remember that small, consistent habits often make the biggest difference in long-term health. Whether it's drinking more water, taking a daily walk, or getting enough sleep, these small choices add up over time. Health isn't about perfection, it's about making the best choices you can each day and being kind to yourself along the way.
That's such a perfect way to end our conversation. Thank you so much, James, for sharing your knowledge and insights about health in English with us today. I've learned so much, and I'm sure our listeners have too.
It's been my pleasure, Amelia. Health is such an important topic, and I'm glad we could explore it together today.
And to all our listeners, thank you for joining us today on Learning English Studio. We hope you feel more confident talking about your health in English after this episode. Remember that your health is your wealth, and taking care of yourself is one of the most important things you can do. Whether you're feeling great or dealing with health challenges, being able to communicate about it clearly makes everything easier.
And don't forget that learning health vocabulary is just like learning any other aspect of English. Practice makes perfect, you know?
That's so true, James. Well, that's all for today's episode. Before we go, I have a couple of questions for our listeners. First, I want you to think about your health habits. What's one healthy thing you do every day? Is it A, drinking enough water, B, getting some exercise, or C, getting enough sleep? Comment below with your choice and let us know why it's important to you.
And here's another question for you. What's one new health-related word or phrase you learned today? Try using it in a sentence in the comments below. Practice makes perfect, you know?
Great idea, James. And don't forget to subscribe to Learning English Studio if you haven't already. We have new episodes every week to help you learn English in fun and practical ways. Until next time, take care of yourselves, keep learning, and stay healthy.
Goodbye, everyone. Stay healthy and keep practicing your English.
Bye-bye.